Hi, Professor Kamakoti. Welcome to this interview, and I'm really happy, delighted to ask you a few questions about your healthcare initiatives in at IIT. First thing I would like to know about, recently or over the years, IIT Madras has been ranked #1 institution within engineering stream and of course the overall also. So what has made that happen?
So if you look at the National Institute ranking framework, it comprises 5 parameters, and each of these parameters would have certain data points. We have around 74 data points. So this question also came to me in the last couple of years when we were debating on why are we #1. And then we found out that each of these data points actually require a very cohesive, focused attempt to improve that on a consistent basis. And the cohesion comes from students, faculty, staff, industry partners, alumni, the Ministry of Education, Government of India, and then the different other ministries for funding us, and then the Tamil Nadu state government. So all of them put together, if we together are needed, there is some amount of contribution from each one of them for each of the data points. So our success, if I could say, over the last 8 years, where we have maintained the engineering #1, and 5 years where we have been maintaining the overall #1, has been that we have been working together in a very cohesive manner. And that cohesion essentially means that we also have certain targets. And I owe a lot of things, these success to our strategic plan that we have. Well, we are focused on that strategic plan and tried to achieve certain objectives there. And that has improved our ranking and improved our score in each one of these parameters. And that is keeping us at #1. This is the answer. So in Tamil we say, Ondru Pattal Undu Vazhu. If we are together, we can succeed. And this is what is the answer.
In fact, Professor Kama, my question is an extension of what you just discussed. If you look at the IIT system itself, right, why is it not just IIT Madras? The IITs have been the icon of higher education, technical, especially when it comes to engineering in India. And why is it that the newer institutions have not been able to set such high benchmarks and achieve as much or catch up as faster? So what differentiates the IIT system in India from the rest of the new age institutions?
There are 3 important things. The first one, I surely say, is the autonomy that we have been provided, in spite of us being given considerable amount of grant. And that we have been put under a special act of the Parliament. And this autonomy is something very important. It gives, as a director, I can say that I have a lot of flexibility to start experimenting things. For example, we started the BS Data Science program, we started the BS Electronic System. I need not ask anyone, right? We just start our Senate. And we together decided on this and we went ahead and did it. Now we have started rural interaction centers. So many of these efforts that we are taking, that autonomy is extremely important, and we must thank the government for providing us this autonomy in spite of giving us considerable amount of fund to run the system. We receive close to $100 million every year to run the system. The second thing is that we had been consistently looking at our quality, the quality of intake both from the student end and also from the faculty end. And that essentially has a very important impact. And this also comes out, we are now, the 60th convocation is going to happen very shortly. 60 years of penance has happened. On an average, an IIT faculty and student works for 14 hours a day. Without looking into clock or calendar, if you just go and find out how many casual leaves people have taken, casual leave CLs, over the last 10 years or 15 years, amazing. Yeah, there are many faculty who have not even taken any leave, right? In the last 20 years, I know faculty who have not gone for something called a vacation. Every 2 years, we are eligible for some leave travel concessions or something like that. Correct. Many of us have only taken some 2 or 3 LTCs in the last 20-25 years. So this is the way people have been working, and that is very, very important for the growth of because just passion and commitment to the cause of excellence in education. The third important thing is our basic evaluation criteria. right? And that is also because today when we set up an exam question paper, we spend more time than the kid takes to answer that question paper. If I want to set up a 15-minute question paper, I spend 3 hours basically trying to see where we can really test the understanding of the people. If you look at the school education system versus the IIT system, why do we have a complex entrance examination? What is done in the school is there is a concept, we ask a question in that concept. Here we ask questions that will use that concept. So that's the bigger difference. And then if you are looking at, say, for example, let us talk about mathematics, right? Just there are questions only in trigonometry, so it will be asked only trigonometry, trigonometric equations, etc. But when you come here, it will be a combination of vector algebra, a trigonometry plus some calculus put together as a problem, right? So we need to know multiple things to solve the problems here. So this is the quality of education and the quality of evaluation that we have kept. And these are the things that are keeping us, on the excellent level, not just IIT Madras, but all IITs put together.
Very well articulated.
Yes.
Yeah. So technology is the driver for the world today. I mean, that's like a secular thing which happens across the world.
Yes.
And now artificial intelligence, Satya Nadella, Microsoft CEO, he said India is #1 in artificial intelligence developers.
Yes.
And I understand IIT is getting into healthcare and related areas in a big way. So how do you see technology, artificial intelligence, and healthcare combination to emerge where IIT Madras creates solutions which could really change after the pandemic? We've had really big problems, not only just in India, around the world.
Yes.
So how you can be the innovation factory for healthcare?
Yeah, very important question, Ramesh. This is something 2047, we want India to be a supreme nation, technologically supreme nation. I always say 1947 we got the social independence, political independence, but we are still technologically dependent. 2047 we need to become technologically independent. Independent in the sense that when I am dependent on, say, Kavi on something, he should be equally dependent on me on something else. And this can come only with innovation and entrepreneurship. There is no other way. We have to become innovators. We need to safeguard our ideas. We need to patent every small idea that we have, protect them, and we need to generate more employment. We need to have more employers than employees. And that is where I will have certain things that I possess and the other country has something that they possess. Both of us cannot be technologically self-contained. I will depend on X on something, but they should equally depend on me on something else. And this equality is what I term as technologically independent. And many things, that equality will come if all my strategic needs I can arm twist on anybody, right? Strategically, whatever is needed, I need to possess. And healthcare becomes one of the most important strategic needs of the country. So that is where IIT Madras and many other IITs and IISc today have started looking at a technological intervention into medicine. Today, let us take diagnostics, today treatment, today robotic surgery, even treatment process. There is a need for understanding the human body from a technological perspective, even to make those devices perfect. Because if I understand the fluid flow, I know how to measure that fluid flow. If I want to make an instrument that will measure the fluid flow, essentially reading to certain parameters that I get for the body, I need to understand how that works. And that is an engineering definition of the human body, or engineering model of the human body is much more accurate. And so this is where we are now pitching in. If you look at the health stack, there is basic genomics and biology part, then comes a physiological modeling of these parts, then comes the devices and the pharmacology, and then the clinical trials. Now, traditional MBBS type of education takes from this biology to pharmacology to this traditional biomedical engineering, takes from the devices to clinical practice. the physiological modeling of the Indian human body is something which is still left, and that is something necessary for us to make inventions and discovery that will have a accurate and measurement of certain parameters and give you a good treatment process, good diagnostics and good healthcare finally. So we have now introduced a Bachelor of Science in Medical Sciences and Engineering, which is going to attempt exactly this, and this is a world-class curriculum, right? And I'm sure that is going to be a very big flagship for our Department of Medical Sciences and Technology. We are also looking at lot of things that a disease network, right? Which disease influences what? A complete. Can I now have a generalist? Right? Today, if I say I am a computer scientist, or a computer engineer, it means nothing. Because if I want to make a product, say this is small mic, right? So I need electrical engineering, I need communication engineering, I need computer science, there's some embedded code there, I need acoustic engineering, I need material science. So 5 or 6 disciplines actually make this small mic that we are all putting inside. So like that, if I'm just a cardiologist, I don't think I can't find the root cause. There might be some cardio problem, but see, people say recently for a person with a stroke and some other problem, the medicine for the other problem will kill the other effect of the other medicine. So this type of a generalist is needed who will understand everything. I think that is where this type of a technological intervention will be a platform where a cardiologist will understand about ophthalmology or a nephrology, and they will start understanding and relating. So we are now going to be a sort of an aggregator where we will take all these doctors and say, man, there is something that we need to understand about each other. Okay. And I think the platform will be created.
Yeah, CEO of OpenAI, Sam Altman, he recently said, India cannot make ChatGPT. It became a big furore in the media where he questioned the ability. So I'm just putting a challenge to you. Can IIT Madras do something, let's say in healthcare, can IIT Madras create a chat GPT for healthcare? Let's call it Dhanvantri. So would you be able to create a Dhanvantri using AI in healthcare? Is it possible, or is it really, I mean, it's just out of curiosity.
Absolutely. So let me just go a little bit behind also. Before Newton invented his Newtonian principles, we had Annambata talking about gravity. Okay, Adyapatana Asamavai Karanam Gurutvam. This has been defined, and this is basically before Newton found out that apple was falling. So appreciation or criticism of Indian school of thought has been there for quite some time. But the point is, we had a language which was not globally attractive, right? Sanskrit is a very elitist language. Very few people understand that, right? So, and many of our Indian languages have their own scriptures, own text where science has been explained, and we have very good explanation of health from our Ayush and related granthas, from our Siddha. These are all things that people have been surviving using Ayurveda and Siddha, and there are some people who lived for 100 years without even touching one allopathy medicine. Okay, so these are all happening. Now there are two things. Let this Chat GPT. There is something called, when you look at computing, there is something called fancy computing, which will make life for you, and then there is something called serious computing. As of now, I see Chat GPT as a fancy computing. Okay, the maximum it can be a human interface, sort of a human interface, equivalent to an human interface, for answering certain questions and chatting. Okay, now how serious? So see, always AI has been successful in where the cost of misprediction is less. Correct. So suppose I say today it will rain and it doesn't rain. You are not going to go to Supreme Court and give a judgment. But if I say there is a disease problem, if I use it for health diagnostics, I think you can't. Basically, it will be only an aid. So this chat GPT will also be an aid for everything. It can't basically go and start solving. For example, chat GPT did not pass my physics, JEE physics exam. Right? So it cannot be a tutor.
My question is it possible by IIT along with researchers to create a healthcare chat GPT using AI?
Yeah. So do we need a chat GPT or do we need a basically a doctor guidance system? Is the question now. That's what I'm coming in.
Okay.
So I don't want something that will replace a doctor. I really don't want. If India has enough population today to employ doctor, and there are people when there is a health issue can pay them and they make a living. So I don't want ChatGPT to be. Whether they can build the systems today, which can be of an aid, a first aid. So suppose somebody, hey, I have this symptom, can you give me? So at least it will give you some immediate aid and then it will say go to the physician.
Absolutely.
So this type of a system alone will work finally. That you can take it as a writing this interview, you can record it. Okay. One chat GPT coming and doing a treatment for you, prescribing medicine, going to and going, impossible. It's not going to happen. Okay. And even if it happens, it will lead to so much of litigations and it will go into man. So this fancy computing, I asked about myself, I asked about a lot of other things. Whatever 3 years before, whatever they have trained is working. Now the next after 3 years, what is going to happen is, because this fellow himself is going to create more information, how it is going to feed and how it is going to update itself is a bigger question that we need to answer. And all with this, it is worth. This type of all these environments. In 1992, when I did my AA course, I wrote one code in Lisp which will keep abusing you. You start, hello, idiot. So just as a fun of this, it will keep you abusing with some context. We wrote it using a language called Lisp. Okay, so but then it was a rule-based system because we don't have data. It was a rule-based system. Now, all these things will be sort of very nice, fancy computing things. But when you really want to go to serious business, of course, this will help us as an aid. So we will be developing AI engines, ML engines. If India has the relevance, if AI has relevance, and the AI is going to be based on data, India is the first prime runner. We have enough amount of data. We are seeing with so many medical schools and medical hospitals and big corporate hospitals today, which are looking at this type of, which has possessed this data. So we have to take these data and form certain very good engines, which can be a very, 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 thought-provoking aid for the doctor. And if I am a doctor with just cardiology and I get an heart patient, looking at his data, this tool can say probably there is also some problem with the liver and there is a gastritis which is trying to pressurize the heart, something like that. No, this type of so this type of a cross interdisciplinary platform is what this AI can do, and this is what we will be attempting at IIT Madras, and I am sure this will be a great contribution to the world. Right? A constructive contribution to the world. And whether we will do it or not, whether I can do a chat GPT or not, should we do it or not is another question. I will not invest that time on doing such type of a fancy stuff, nor my faculty will do. What we will be interested today is something like an LLM, a large language model. Because today when I want to remove the digital divide for my country, I don't need a chat GPT today. I want basic language translation. I talk in English, I want it in 22 official languages of the country. So I will work on such type of large language models rather than doing these type of things. Okay.
I think that's thank you for that elaborate and detailed reply, very elucidating actually, and illuminating. Another question, Professor Kama, is that if you look at global stage, take someone like Bill Gates, he has been able to really drive and steer the public health care and influence it in various ways. Do you envisage any players like that coming up in India, say for example Adani Group or Apollo Group, any of them coming up in India in a way similar to that of how Bill Gates was able to influence the global public health care for us at a national level? How would you envisage?
Absolutely, with the National Digital Health Mission coming up and personalized health records that is coming up, and also the lessons that we learned from the COVID, I think has changed the mood of healthcare in India. lot of people who can invest money and at the same time have access to technologies. For example, if you take the Apollo group or the other large hospital network that is there in the country, including Adani, I think they have a set of hospitals. Anybody who has a set of connected hospitals, I think they are in a very good position because they are the Googles in terms of having the data.
Okay.
And that data they must preserve. They should not give it out. And then basically make it into whatever anonymization. And that is the gold mine for them. And that they come and join with an equal, with a like-minded person who can use this data for good in terms of building up what we just talked in the previous question, like a large AI model, which can become a good aid for the doctor. That is something very important. And today telemedicine is becoming very important, and I need to do a lot of things on scale, right? So I would like some sort of a quick diagnosis that is important. If you give me today, I did what you call as this master checkup, and it gave me a 50-page report. Now, if I go and give it to a doctor, and my doctor is very good, and he wants to completely look because he wants me to be well and healthy. He looks at all the 50 pages, takes 1.5 hours to do that careful diagnosis. Now, if an AI tool can take this data and tell the doctor, hey, look at this is not correct, this is not correct. And if he can just say, can you just comment about this fellow's blood pressure, then they say, so these parameters are correct. I don't think something is wrong. Then he'll go to that page and see, okay, this is correct. Okay, then he just, okay, fine. Or this is wrong, just go and investigate. This type of a very interesting thing will come out of these large corporates because they have a lot of data. So, large corporates today making a big national impact. And what, as a consequence of it, what happens is the time I spend to actually diagnose and prescribe a treatment for a patient as a qualified doctor decreases. The time decreases. So I can now handle multiple patients, more number of patients. So throughput, if you can say, of number of patients that I could do, and also without compromising the quality of my diagnosis ability. I think that is where this will play a very important role. Today, if you look at the footfall, if you look at some of these groups, why these groups are important? Because they have scaled. They are not looking at one hospital. So you have some 100 hospitals within Chennai, you have a group of hospitals. And when they scale, the reason for them to scale is because they are getting more footfall. There is a need. And now, so their aspiration is to go and reach more and more people, correct, as a group. Now, this type of an intervention will increase the footfall, increase the throughput in every hospital, so they can now, with one doctor, if they are treating 10 patients, with this type of an AI intervention, they can now start treating 100 patients. And that is good for the hospital, that is good for win-win for all. Right? As a hospital, I get more. And that will feed, I'll get more data because of that. Okay, so because I'm treating 100 patients. So this will be a very nice constructive cycle that will be created. So a big group like Adani or Apollo, now having data that feeds into a good AI type of model that creates a good type of diagnosability. Now the number of patients they do per hour is going to increase, and by that they are going to get more data, and that is going to keep pumping, and this goes on a very good cycle. I think that is the way we can also today, the number of doctors per every 1,000 people today is phenomenally less. Now this throughput increment is also very important, and that is where these groups will certainly start coming up, and that is the next thing, and we will make a better impact.
No, in fact, my next question is a little bit of a rephrasing or an extension of the previous question or a different variant, let me say that, right? Like, so if I look at any of these groups like Adani Group or Apollo Group or any of that, is it actually important to have private organizations like that coming in and actively contributing? Is it essential to scale up innovation in healthcare, or is government funding just sufficient? So how important and essential it is to have all these corporate players contributing and making an impact in the society in the healthcare.
I'll add on to what he says, because the general feeling in India is that when the large corporates come, their motives are profit making, the cost of healthcare goes up, and the general public cannot afford that kind of thing. So what probably he means is, how do we balance the cost versus the
benefits, overall
benefits.
benefits.
So that is where technology is going to play a role. One thing is, there are certain government institutions which are also very good. I am a government institution by myself, okay, right? So it's not just government versus private, but the role of private industry. So today I am getting a lot of funding from the private industry, by which we are also setting up good things here. So this collaborative effort is what is very, very important. That's what I feel here. So even when I said, why are you NIRF1, I did bring industry and the Ministry of Education, or also our partners who have worked together to make us NIRF1. So there is an equal contribution from the government and also equal contribution from the private. The role of private cannot be just ignored in this case. They have to come, they have to pitch in. Because for us to execute certain things at the private is going to be much easier than actually going through a government mechanism, because we are a large democracy, we have our own rules, regulations. We can't just keep lightening our rules, because that may lead to other sort of issues. So we need to have certain governing regulations, but private has a much more easier way, because today Apollo decides, I want to set up an hospital there, they have to go for some permissions, but then the decision of investment, everything is with them. They need not go and explain somebody why I made this. Correct. So they can decide, okay, I'll go with this contractor, I'll do in 3 months, 4 months.
Absolutely.
But here and now in the government setup, I have to go through a tender mechanism, because that's the way I pay, the way by which I use taxpayers' money. But from the way I use personal money, that's a difference, and that difference has to exist, and in a democracy that's very, very important, because taxpayers, we are liable to the taxpayers. Okay, this is one part. So there is an ease by which we can scale if the private industry comes and pitches in, right? So that is very, very important. So this is my very simple answer to your question, that private industry, private group interference is very much necessary if we want to scale. And today the cost is basically because of my lack of scaling. Right? Today, say for example, you get a cancer treatment, it goes up to 400 crores. How do I recover? See, I'm paying depreciation on it. It's an electronic goods. I have 20%, 30% depreciation next year. So how do I recover? So the cost, that is one of the reason why the cost is going up. And the majorly why the cost is high is because of imports. Today you go to a dentist, for keeping your mouth open, they keep one stick, and that is imported today. Right? Unfortunately. So now what we need to do is that based on this effort, we need to start developing certain indigenous technologies. The bill of material, I am sure for many of the medical equipments is 1/10. This is 10x it's a profit. Why good? Because they have gone through FDA approvals and everywhere across the world, and they are now selling, and they also bring in some certain service level agreements and in terms of quality and etc. There is some big liability that they are also taking. But we need to break that by bringing lot of indigenous development, which will bring down the cost of treatment, and perforate it more with digital technology. And the most important thing today is training. If a nurse can solve the problem of what today a doctor has to intervene, I think doctor can be attending to serious cases. And how can the nurse basically handle today if I could not have taken the blood pressure of my father on a daily basis when he had a small stroke. But since I had an instrument, I was able to take it. I had 2 instruments, I took the average, and I was able to communicate to others that it's normal. So a doctor need not have come. A nurse, I have stopped a nurse from coming in, right, because of this digital technology. So this type of an intervention of certain small things which can be done at a lower level, this can basically make the doctor relatively free to handle some complex cases. And by this what happens, and also by all this data stuff, if I could come out with a prevention is better than cure. It actually originated from medicine. Right? This proverb originated from medicine. If I am able to prevent people from getting certain diseases, and building certain immunity. I think these are using technology on a mass scale. Today I want to do a complete breast cancer screening of the entire district. Today it's not possible. We need to come out with some innovative things for that. And if I am able to get out breast cancer out, the number of cancer patients decreases. Right? So these are some ways by which we can bring the as an individual, amount of money I spent in my lifetime for healthcare versus pressure that is going on to the medical
system.
system.
It's very essential to have private participants. Very clear and categoric viewpoint on that.
Kaviraj, we have seen this in telecom sector also. I mean, the private participation has really brought down the cost of and created a scale with the most advanced technologies available. So if telecom, I mean, they can do it, so why not healthcare? And so
efficiency has gone up.
So my simple, I'm not an economist, but the simple thing that I have understood here, there was one shampoo which was selling one bottle of 50 ml for 100 rupees, nobody bought. Then they made as 5 ml into 10 sachets, and each thing was for 7 rupees. Okay, so then that 7 in 10 was 70 rupees. They were saving the same quantity they were selling for 70 rupees. But everybody started buying it. 10 ml, 5 ml sachet, 14 such sachets for the same 15 ml, 10 sachets for went to 10 people, rather than this 50 ml went to only one person. Okay, so this is how healthcare also, I think, will manifest itself. Right?
So thank you, Professor.
Oh, thanks a lot.
Your enlightened views on healthcare.
So we are now this department we have started. We have the Bachelor of Science in Medical Sciences and Engineering. I, as a director, and after educating computer science for more than 2 decades, believe that in the next 5 years this will replace computer science and engineering. Right? And
as the topmost choice of
as
students?
As the topmost choice of the students. Wow. Today we have 30 seats, and we have already seen around 6,000 applications for the 30 seats. I believe that this is going to happen, and this is very, very important. And I also want to tell, I've been writing about this very openly, that people who do engineering should continue in that core engineering. Otherwise, it's a waste of resource. Right? We train people day in and day out. For example, I train people in the area of within computer science and computer architecture, and after that they go and do some high frequency trading. Then India needs computer architects. Maybe it's not as high paying or it's not as easy as high frequency trading, but the core job must be maintained. And especially in health, if in the strategic sectors, if a person doing, say, biology, biotech, goes off to some IT job without leaving completely all this, then India cannot develop on biotech. India cannot develop on this. And we need these type of core specializations. I don't know how to solve this problem, because even when I want to get faculty here, I know many faculty have left us with 10x salary. So money is needed everywhere. If even today I want to run the medical sciences, I have to go and ask for funding, right? So without money, nothing will work. But that is very, very important. I don't know how to solve this problem, but then the other end is very, very important. So if you ask me what is the challenge as a director of NIRF1 institution for the next 4 years, how to make my young kids stick to the core engineering. And that is also very important, because we now want to go on the innovation and entrepreneurship route. I want this kid to understand some good thing about civil engineering, some bright idea, and we say, okay, we'll nurture that idea. This is an idea, this is your first friend, please love that friend and be with that friend for some more time and experiment. And in the second, third year, make a startup company, give a card, you are a CTO, you can show to your mother, father, girlfriend, boyfriend, everything. Okay, show off. That's very nice. And then make them stick to that idea. In this way, that's a win-win for us, because as a country, we need employers, we need innovation entrepreneurship, and we also have people sticking on to their core discipline for some more time. Hopefully, they become successful. So this is also a major effort. In the interest of the country, I also make through this channel, through your channel, I am making a request to all the big corporates who can invest money to support innovation and entrepreneurship in a very big way in the institutions. They can come, they can evaluate company, but give them, it's a high risk, high reward. So we want Atmanirbharta. Atmanirbharta always will come only with Atma Vishwas. So let the Indian big corporates and startups, big corporates and other groups who can afford some money, have a lot of confidence on our own young kids and let them invest on our kids. This is a request I make through this channel.
Just
Thank
one
you.
last question, because I forgot earlier. Recently, ICICI, for example, they gave 1,200 crores to Tata Cancer to increase a bed size of 25,000, because that was a scaling up. So that is another contribution of a large corporate to create healthcare infrastructure. I wish they could be like insurance companies, banks, the private sector, top corporates. Each one of them 1,000 crore as a CSR is not very difficult. It's spread maybe over years.
Yes.
That can create a tsunami of medical.
I will say, so insurance companies can invest in IIT Madras Medical School. They can give us 1,000 crores over the next 4 or 5 years. Certainly, all the people they insure, they will live for much more longer, and they will bring them back that money. So and if you start giving it for a good cause, it will only multiply, right? So never a charity has not made somebody poor. Okay, charity has made them only rich, right? In whatever sense. So this is a very interesting thing. So I think we should talk to insurance companies saying, hey, we are doing so much research by this over a period of time. All the fellows whom we have insured will not have any health issues.
They will make lot more profit, insurance companies, because they are statistically, if people do not fall sick, they do not die, the profits increase. So it's a win-win.
And more than that, on the preventive also. So we say that, okay, we give certain packages by which, every insurance company today say you can go and do a master health checkup free. Now if I have a preventive healthcare based on AI models on this, now these insurance companies will, because in another 5 to 10 months, your cholesterol is going like this, you will land up with some issues, control. So immediately from morning, he'll start walking, he'll do some exercise, he'll start eating some walnut. Cholesterol, good cholesterol will increase, bad cholesterol will decrease. So there is no fit. So just by giving that type of preventive stuff, and for that there may need to be system. And I don't just believe that foreign systems will come, I just take the ChatGPT challenge. I think if given, I'll also take the challenge. And see, IIT Madras can develop something for the medical. Of course, we'll do that. But what I'm saying is, if these people invest in this type of mechanisms, where we can basically give this type of a treatment schedule and preventive healthcare, proactive. Prevention is better than cure. No, we can go that. I think insurance companies will benefit. So insurance company must think about it. And you have given me ideas. I'll talk to LIC tomorrow for a possible funding for some of these research.
LIC, there are many of them.
Yeah, many of them. Okay.
So I'm very happy that you have taken the challenge of healthcare ChatGPT as Atmanirbhar.
And the views that come from the person like him who has a comprehensive view of things, I think it's very insightful, and the optimism that you exude, so it's very reassuring about the future, right? I think it's very reassuring, like there's a lot of scope and opportunities.
Thank you very much.
Okay.
It's been a very thought-provoking interview.
Okay. Thank you.
Thank you very much.
Right. Bye. Yeah. Bye.